on-demand video page of the legislature's website. In the unlikely event that we must abruptly end this hearing due to major technical difficulties, the committee will reconvene to discuss any outstanding business on Friday, February 12th at 1:15 p.m. and a public notice will be posted on the legislature's website. For all the testifiers who are on the conference call right now, thank you for joining us. Your audio and video will be muted, and we ask that you disable your video until it's your turn to testify. We do ask that you respect a 2-minute testimony time limit. There are a number of measures on the agenda, and we don't want to run out of time. We've also provided the testimony to all of the members. I have reviewed all of the testimony submitted. So if you'd like to stand on your comments or add additional comments that aren't featured in your written testimony, I'd encourage you to do so. If there are any temporary technical glitches during your turn, please be patient. We may move on to the next person, but we'll try to come back to you. I'll be reading a list of individuals who've submitted written testimony, and we apologize if the closed captioning doesn't accurately transcribe your names. And if you're interested in reviewing any additional testimony, you can visit the legislature's website at www.capital.hawaii.gov. Okay, on to the agenda. The first measure is SB 602, relating to pharmacy benefit managers. This prohibits certain activities as it relates to pharmacy benefit managers and requires the insurance commissioner to file annual reports to the legislature. First testifier we have listed is from the Department of Commerce and Consumer Affairs, the insurance commissioner, Mr. Hayashida.
Good afternoon, Chair and members of the committee. The department stands on its written testimony offering comments and will be available for any questions. Thank you.
Thank you very much. Next, we have the Department of Health offering comments.
Good afternoon, Chair Keokalole, members of the committee, Lauren Kim, Policy Director for the Department of Health. We will stand on testimony. We'll stand on our testimony offering comments, but I would like to highlight the opportunity to clean up statute with an orphan section that may cause confusion and among regulatory agencies for pharmacy benefit managers. Section 328-106, we're asking for it to be repealed. Thank you.
Thank you very much. Next, we have Kaiser Permanente offering comments.
Good morning, Chair, Vice Chair, committee members. Thank you. John Kirimitsu, appearing for Kaiser Permanente. Kaiser would like to stand as testimony, but just would please ask that we be allowed to exclude health maintenance organizations that own and manage their own pharmacies, as we have been allowed to do in the past on previous PBM bills, since this PBM bill is regulating third-party PBMs. Thank you.
Thank you very much. I'd like to acknowledge the presence of Senator Moriwaki on the conference. Next we have, oh, I'm sorry, I went a little bit out of order. Submitting late testimony from the Employer Union Health Benefits Trust Fund, Mr. Mizuno.
The ETF would like to stand on our written testimony, providing comments. Thank you.
Thank you very much. Next, we have CVS Health in opposition.
Good afternoon, Chair, Vice Chair, and members of the committee. Lori Lam representing CVS Health. We do have some concerns regarding this bill as currently drafted and would welcome the opportunity to work with you and stakeholders as this discussion continues. I would just like to highlight 3 provisions in the bill that we believe will take away contract flexibility for employers and plan sponsors and could lead to higher healthcare costs. So the first is the ban on spread pricing, and many clients do choose this option because it provides them with more certainty in their pharmacy costs and allows them to budget in a more predictable manner. The second is the bill seeks to prohibit a PBM from reimbursing an independent or rural pharmacy an amount less than the rural rate for prescription drugs. And it should be noted that typically rural pharmacies are paid higher reimbursement rates because they have lesser patient volume and also are important for patient access, but not all independent pharmacies are rural pharmacies. And therefore, independencies in urban areas, for example, their reimbursement rates would account for this. Finally, there's a transparency regarding the bill would require the disclosure of competitively sensitive information with no confidentiality provisions. And the FTC has reviewed this, and they have opined that such knowledge of competitors' pricing information would dilute incentives for manufacturers to bid aggressively, which again could lead to higher prices. Thank you for the opportunity to testify.
Thank you, Lori. Next, we have Pharmaceutical Care Management Association, Bill Head.
Thank you, Mr. Chairman, Vice Chair Baker, and members of the committee. Thank you for the opportunity to testify today. I would just echo Ms. Lum's highlighting those three issues. And I would just, rather than repeating what she said, I would just add that with respect to rebates, it's important to remember that rebates were the creation of the pharmaceutical manufacturing industry, not PBMs. But we have certainly used them to the advantage of payers by exerting downward pressure on manufacturer prices. And the concern is that if that information is then disclosed among competitive manufacturers, that ability to exert that downward pressure will go away. And that is what the FTC is warned about, is it could have the unintended consequences of having the exact opposite effect of what you're trying to achieve. So I would just stand on our testimony and echo Ms. Lum's testimony as well, and look forward to any questions or comments. Thank you, Mr. Chairman.
Thank you, Mr. Head. Next, offering late testimony and support, Queen's Health Systems.
Aloha, Chair J.C. Mike-Elonic on behalf of the Queen's Health Systems. We'll stand on our written testimony and support, and appreciate the transparency and oversight of PBMs that the bill would provide. Thank you.
Thank you very much. Excuse me. Also offering testimony, but the following individuals also offered testimony, but indicated they would not be present. In opposition, the Hawaii Association of Health Plans. In support, the Hawaii Primary Care Association. Also in support, PharmaCare Hawaii. HMSA in opposition. Times Supermarkets and Times Pharmacy in support. Cigna in opposition. And also in support, Kevin Glick, Megan Arbles, and also submitting late testimony in support were Carrie Oyatamori, Magdi Latif for BB Incorporated, and the National Community Pharmacists Association. Did we miss anyone on the conference? Okay, seeing none, members, any questions on this measure? Okay, we're going to move to the next measure, SB 605, relating to prescription drugs. This measure requires drug manufacturers to notify prescription drug benefit plans and pharmacy benefit managers if a proposed increase in the wholesale price of certain drugs would result in a 16% or more increase in prices over a 2-year period. Also requires the drug manufacturer to identify and report to the insurance commissioner information on certain drugs whose wholesale acquisition cost increases by a certain amount during a specified time frame. First up, we have the insurance commissioner, Mr. Hayashida.
Good afternoon, Chair. The department stands on its written testimony, offering comments, and will be available to answer any questions. Thank you, sir.
Thank you very much. Thank you. Offering opposition testimony, the Pharmaceutical Research and Manufacturers of America, William Gu.
Good afternoon, Chair, Vice Chair, and committee members. My name is William Gu, testifying on behalf of Pharma. Pharma stands on its written testimony in opposition to SB 605 as to the meaningfulness and constitutionality of giving advance notice of wholesale drug cost increases. Thank you for the opportunity to testify.
Thank you, Mr. Gu. Offering testimony in support, AARP Hawaii.
Good afternoon, Mr. Chairman and members of the committee. Audrey Suga Nakagawa from Aarp Hawaii. We support this measure. You know, we always support policies that help reduce the price of medications, especially for all consumers, but especially for seniors who really depend on them. And so this bill provides more disclosure and transparency so that there's more meaningful information for the state, and then provides accountability from the manufacturers. So thank you again for the opportunity to testify in support.
Thank you. Also offering written testimony, we have the Hawaii Primary Care Association in support, Andrea Quinn in support, and offering late supportive testimony are Magdi Latif and David Mikami. That's all the testimony we've received here. Did we miss anyone on the conference? Okay, members, questions? If not, we're going to move on to SB 1191 relating to electronic prescription accountability system. This is an administration bill which clarifies who may access information stored in the electronic prescription accountability system. First up, we have the Department of Health. Okay, they indicated testimony in support, and we also have written testimony in support from the Department of Public Safety. That's all the testimony we've received. Is there anyone on the conference who would like to testify? Okay, members, questions? Hard with no one here. We'll move on to the next measure, SB 1192, relating to electronic prescription accountability system. This is another administration bill that will require the dispensing of pharmacist-prescribed opioid antagonists to be reported in the state's electronic prescription accountability system. Offering comments, we have Kaiser Permanente, Mr. Kiramitsu.
Thank you, Chair. Kaiser stands on his testimony offering comments.
Thank you very much. And offering written testimony in support, we have the Department of Health and the Department of Public Safety. So that's everything we have on this. Is there anyone on the conference who would like to testify on this measure? Members, questions? Okay, moving on to the next measure on the agenda. SB 1155, relating to health. This authorizes issuance of licenses to solemnize marriages for persons of secular or non-religious organization. First up in support, the Department of Health.
Aloha, Chair. We stand in strong support and stand by for questions. Thank you.
Okay, we also have written testimony submitted by the LGBT caucus of the Democratic Party of Hawaii in support, and supporting testimony from Michael Goliu Sr., Justin Salisbury, Eileen McKee, and Nikos Leverance. That's all the testimony we've received. Is there anyone on the conference who'd like to testify? Okay, members, questions? Moving along, SB 1242, relating to trauma-informed care, establishes a trauma-informed care task force within the Department of Health to make recommendations of trauma-informed care in the state. First up, we have the Department of Health in support. Okay. The Hawaii Youth Services Network in support.
Aloha, Chair, members of the committee. I'm Judith Clark, representing Hawaii Youth Services Network.
Ms. Clark, can you pull your camera down a little bit? Gotcha.
Sorry.
Thank you very much.
We are in strong support of this bill. Everybody in Hawaii has experienced trauma in the last year, including every one of us who is attending this hearing. We've experienced the pandemic, the economic devastation, the educational disruption, and much more. And so now more than ever, we need to ensure that services to our children, youth, families, and kupuna use a trauma-informed approach. We need to prevent exhaustion and burnout among our most critically needed service providers. Thank you for this opportunity to testify.
Thank you very much, Ms. Clark. Also offering testimony in support, Daniel Goya.
Not present, Senator.
Okay, thank you. We also have written testimony in support, all supportive testimony, including the Department of Human Services, the Executive Office on Early Learning, the Office of Hawaiian Affairs, the Hawaii Primary Care Association, Hawaii Pacific Health, Kinai Eha, the Hawaii Substance Abuse Coalition, Kamehameha Schools, Imua Alliance, the Hawaii Children's Action Network, and a number of individual testifiers, including Jamie Goya, Ray Ogai, Tian Pereira Benavides, Myra Halpern, Shanisa Respicio, Kiana Bourne, Marshall Raposa, Kaveni Ibarra, and late testimony in support from the Hawaii Community Foundation and Tia Robert Hartsock. That's all the testimony we have on this. Is there anyone on the conference who would like to testify? Okay, members, questions? Okay, seeing none, we're going to move to the next measure, SB 1186, relating to the Uniform Controlled Substances Act. This updates the Uniform Controlled Substances Act, Chapter 329, to make it consistent with amendments in federal controlled substances law as required in Section 329-11 Hawaii Revised Statutes. First testifier we have in support, Department of Public Safety, Mr. Radula.
Good afternoon, Chair, Vice Chair, and members of the committee. Jared Radula, the State Narcotics Chief. We are going to stand on our written testimony in support. I did want to point out to the committee a very succinct point in our testimony. We don't often delete or remove controlled substances regulation. In this particular proposal, there is a proposal to remove a specific drug known as Epidiolex, which is the single FDA-approved drug that is derived from cannabis. This said, we are simply proposing to remove regulation over that specific drug only, and we are not intending at all to regulate any CBD or cannabidiol that are commonly found in markets, stores, gas stations, and shopping malls. Thank you very much.
Thank you. Testifying for Greenwich Biosciences in support, Naheilani Webster.
Good afternoon, Chair, members of the committee. Naheilani Webster testifying on behalf of Greenwich Biosciences in support of Section 7 of this measure. As the Department of Public Safety mentioned, we're in strong support of Epidiolex, which is the only FDA-approved plant-derived cannabinoid product for the treatment of 2 rare forms of childhood onset epilepsy. Descheduling from the Uniform Controlled Substances Act will conform with recent updates in federal law. We thank you for the opportunity to testify, and we're available if you have questions.
Thank you very much. Also testifying in support, Clifton Otto.
Good morning, Chair, Madam Vice Chair. Thank you for the opportunity to testify on this measure. My name is Dr. Clifton Otto. I'm a medical doctor and practicing cannabinoid medicine specialist in Hawaii. I just wanted to expand briefly on that I'm proposing in my written testimony. This bill is very important because it highlights the necessity of harmonizing the state and federal regulation of controlled substances. This harmonization is so important that it's something that's written into our Uniform Controlled Substances Act in order to keep the state and federal regulation of controlled substance consistent. I'd like to contrast this against our medical cannabis program, which is a perfect example of what happens when you do not have consistency between the federal and state regulation of a controlled substance. So this conflict has been creating a discrimination against the very patients that this program is supposed to be serving from public and private organizations across the state. Our state program is based upon the state's authority to decide how controlled substances are used within the state underneath the U.S. Constitution. The problem is a federal regulation that's being unconstitutionally applied to our program. By doing nothing, we are simply encouraging criminal activity across the state. And by waiting for the feds to fix this problem, we are simply jeopardizing our state's authority to control the state authorized use of cannabis in the future and to fulfill the vision of the drafters to promote Hawaii as a international research center and treatment center for cannabis. I'm offering a solution for this problem in the form of a federal exemption. I suppose that the committee could consider delaying decision-making on this measure and issuing a proposed SD1. I guess another option would be to consider including this amendment in the decision-making that will occur after this hearing for SB 89. Either way, I hope that the committee allows us the opportunity to discuss this possible solution directly in the public hearings. Thank you for hearing this testimony. Aloha.
Thank you, Dr. Otto. That's all the testimony we received on this measure. Is there anyone else on the conference who would like to testify? Okay, members, questions? Okay, seeing none, we're going to move to the next measure on the agenda, which is SB 1340. Relating to emergency medical services, this enables the Hawaii Medical Board to certify medical responders other than emergency ambulance service personnel. Up first, offering comments, the DCCA, Ms. Kyoki.
Good afternoon, Chair, Vice Chair, members of the committee. The Hawaii Medical Board will stand on its written testimony, providing comments. Thank you.
Thank you. Next, we have the Department of Health. Department of Health offering comments. Next, we have AMR, Speedy Bailey in opposition.
Hey, good afternoon. Chair, can you hear me?
Yes, I can, but we can't see you. Can you activate your video, please?
Yeah.
Thank you.
There you go. Good afternoon. Thank you. I'm the Regional Director, Speedy Bailey with American Medical Response. And we oppose this bill because it significantly deregulates our industry, the ambulance industry. I think this is a bona fide attempt to gain recognition for essential firefighters and lifeguards as part of the EMS system. We certainly agree with that need for recognition and would suggest that there are other ways to accomplish that. But by this deregulation, you're really confusing the industry, and I speak for many in EMS, that all the EMTs that have worked for decades, reducing the training levels and calling all EMTs the same thing is very confusing, not only to the industry stakeholders, but also to the public. And we've had in Hawaii a standard of care for 40 years that has served Hawaii very well in EMS. And we've always maintained standards well above the National Registry standards, and we're very proud of that. And this bill, in effect, makes that change. So we would respectfully suggest that the recognition can be obtained through licensing the National Registry EMTs as emergency first responders. And this has been discussed in Hawaii for many years, and it's also actually one of the recommendations from NHTSA, from the National Registry of EMTs, and NEMSO as an adjustment that Hawaii has. Anyway, so I thank you for your time. I think calling all EMTs is like calling all nurses. We have LPNs and RNs, and they have differences in their training requirements. So just saying everybody is an EMT and is an EMT is not accurate. So thank you very much.
Thank you very much, Mr. Bailey. Next, I'd also like to note written testimony submitted in opposition from Paradise Medical Services, David Kingdon, Kurt Morimoto, and also late opposition testimony from Andy Anchia, Dr. Tin Nguyen, and Cody Bonilla. That's all the testimony we've received. Is there anyone else on the call who would like to testify? Okay, members, any questions? Seeing none, we're going to move to the next measure, SB 1144, which related to marriage license fees. This amends marriage license. This amends the marriage license statute to support the Hawaii Birth Defects Program, modernization of the vital statistics system, and operating costs of marriage license agents. First up, we have the Department of Health in support.
Good afternoon, Chair. My name is Matthew Shim. I'm Chief of the Family Health Services Division for the Department of Health. We stand on our testimony in strong support of this measure. One detail that I did want to share is that the birth defects program consists of 4 staff, and the salaries of staff from 2002 have basically doubled from about $170,000 to current salary levels about $332. So the increase in marriage license fee would help to pay salaries for the staff. Thank you.
Thank you very much. We also have written testimony in opposition from the Domestic Violence Action Center and supportive testimony from Leah Minton. That's all the testimony we've received. Is there anyone on the conference who would like to testify? Okay, members, any questions? Okay, we're gonna move along to SB 839 relating to health. This authorizes advanced practice registered nurses, in addition to physicians, to practice medical aid in dying in accordance with their scope of practice and prescribing authority. This authorizes psychiatric mental health nurse practitioners, in addition to psychiatrists, psychologists, and clinical social workers, to provide counseling to a qualified patient. Reduces the mandatory waiting period between oral requests from 20 days to 15 days, and waives the mandatory waiting period for those terminally ill individuals not expected to survive the mandatory waiting period. First up, we have from the DCCA Board of Nursing, Leanne Tashima, offering comments.
Thank you, Chair. We'll stand on our written testimony, and if you have any questions, we'll try to answer those for you. Thank you.
Thank you very much. We also have the Hawaii State Center for Nursing, Laura Reichart.
Thank you, Chair. The Hawaii State Center for Nursing stands on our written comments and are available for questions. Thank you very much.
Thank you. Offering testimony in support, Compassion and Choices, Samantha Trad.
Thank you so much, Chair. Thank you, Senator Baker, for sponsoring this important bill. We stand on our written testimony and urge you to support it. Thank you very much.
Thank you. In support, the Hawaii Society of Clinical Oncology, Charles Miller. Okay. Also indicating that they would be present, but offering late testimony, Susan, I think that's Piccola Davis, in opposition. Susan, are you with us? Okay. Also offering written testimony in support.
Sorry to interrupt,
Hello?
Senator. Susan is in the call.
Oh, okay, please go ahead.
I noticed that I would have a problem saying your name also. So I started with good afternoon, Chair and Vice Chair of the Senate Health Committee and committee members. Can you hear me all right?
Yes, please proceed.
My name is Susan Piccola Davis, and I want to point out several high points of my written testimony, and I will be here for questions. I noticed that there were 124 pages of testimony and over 100 in support. I ask that you please not make a decision based on the majority. 3 problems with this bill. Number 1, adding APRNs. Number 2, reducing the waiting period from 20 days to 15. Waiving the waiting period if a provider, that could be an APRN, believes that the patient will die within the 15 days or 20 days if we leave it that way. So some of the concerns besides that is that we're giving, in past bills, we continue to give APRNs more scope or increase their scope of practice. And to the point where I think we really have to think about why we're doing that. Many of the providers that were included in the 2020 report to the legislature, there were only 13 physicians that wrote prescriptions. Now, in some of the testimony, I've seen that there's a reason why physicians aren't signing up for this. but I guess it has to do with do no harm. In July 1st, 2020, there were 30 qualified patients for aid in dying prescription. 23 died in a form of cancer. 15 died through the ingested aid in dying prescription. Okay. 3 received the aid in dying prescription, but since the follow-up form was not received by the department, they don't know what happened to that medicine. Okay. One complication was a patient took DDMP2. It took over 6 hours for this patient to pass away. And yet they're allowing 4 hours. So I'm just saying, you know, some of this information, maybe we should stick with the way it is right now and not try and throw
I'm going to ask you to please finish up your comments. Thank you.
I think I've said enough. Thank you.
Okay, thank you very much. We also have written testimony in support from the Hawaii Psychological Association, opposition testimony from the Hawaii Family Forum, supporting testimony from the Hawaii Islands Association for Marriage and Family Therapy, the Hawaii Association of Professional Nurses in support, Dr. Linda Beechenor of the Hawaii American Nurses Association in support, late testimony in opposition from Hawaii Professionals for Appropriate and Compassionate Care, and late supportive testimony from the Kupuna Caucus of the Democratic Party of Hawaii. There are also, as Ms. Pakola Davis noted, 50 individual members of the public who submitted testimony in support, and those can be viewed by the public on the legislative webpage, status page for this measure, SB 839. And there were also 7 individual members of the public who submitted testimony, written testimony in opposition. That's all the submitted testimony we've received on this measure. Is there anyone else on the conference who would like to testify? Okay, seeing none, members, do you have any questions? Okay, I have a question actually. Is that? Oh no, I thought the Hawaii Association of Professional Nurses would be present, but they are not, so we're gonna move on. The next measure is SB 134 relating to emergency powers. This prohibits the governor or the mayor from suspending requests for public records or vital statistics during a declared state of emergency. The first testifier we have on our list in support is the Civil Beat Law Center for the Public Interest.
Good morning, Chair, Vice Chair, members of the committee. Brian Black, Executive Director for the Civil Beat Law Center for the Public Interest. We'd stand on our testimony in support, and I'm available to answer any questions. Thanks.
Thank you, Mr. Black. Also in support, we have Ms. Pakola Davis.
I think you can hear me now.
Yes, we can.
I
Please
support
proceed.
this bill in order to stop the overreach of the governor and or the mayors during this pandemic. The ability to gain access to public records is unconstitutional. I'll give you an example. I did request records early on and I didn't receive a response. I was just ignored. I believe the reason I was ignored was because I was asking the Department of Health for records regarding COVID cases and their locations. This is way before they set up their dashboard, as opposed to the zip codes, which is what we're using now and does not give us really any information but nice colors on a map. The public laughs at the appearance of transparency, but preventing access to the actual data is shameful. Lack of trust from the public has grown exponentially since March 2020. And I would add that if he's going to keep on making emergency proclamations, when there is another emergency, such as a hurricane and there's damage like what happened to Kauai, or volcanoes erupting, destroying homes, is he going to also declare an emergency and start not allowing us to see records? Thank you very much.
Thank you very much. Also submitting written testimony, the Office of Information Practices offering comments, the Hawaii chapter of the Society of Professional Journalists, Sterling Morita in support, All Hawaii News, Nancy Cook-Lauer in support, the League of Women Voters in support, the Big Island Press Club in support, and late testimony from Mr. Robert Dewar in support. That's all the testimony we've received. Is there anyone else on the conference who would like to participate? Okay, members, any questions? Seeing none, we're going to move to the last measure on this 1 p.m. agenda, SB 1138. This is relating to the Office of Healthcare Assurance Special Fund. It increases the ceiling of the Office of Healthcare Assurance Special Fund to meet expanding program needs and diminish dependence on the general fund. First up, we have the Department of Health.
Good afternoon, Chair. Keith Ridley on behalf of the department. We stand in strong support of this bill. We ask that there be some amendments to the bill to reflect the evolving situation of the finances of the state. The bill, of course, is an attempt to reduce the reliance on the general fund by shifting costs to the special fund. So this bill asks for removal of spending cap in statute instead of raising the ceiling to remove the cap. And then also we're asking for contingency spending authority during times of emergency. I'm available for questions. Thank you.
Thank you, Mr. Ridley. We also have written testimony and support from the Hawaii Primary Care Association. And that's all the testimony we've received on this measure. Is there anyone else on the conference who would like to testify? Okay, members, do we have any questions for the Department of Health? Okay, seeing none, we are going to recess for decision making. Recess. Okay, we're going to reconvene the 1 p.m. agenda of the Senate Health Committee, February 10th, for decision making. First bill up is SB 602. This is the Pharmacy Benefit Manager legislation. There are a number of issues that, we had a lot of testimony and a number of issues that I think need to be worked out. So I'm going to defer decision making on this bill until Friday, February 12th at 1:15 p.m. Seeing as how the next committee to see this measure is consumer protection, and we have the vice chair here. We're going to try and work on a measure that makes the most sense before I can take it up again in hearing. The next measure, deferred until Friday. The next measure, SB 605, as noted in the testimony, this item could possibly be addressed in the first measure, so we're going to defer this bill. Any discussion? Okay, next measure, SB 1191. This is the governor's administration package bill. Oh, wait, did I get that right? Yes, governor's package bill related to prescription, electronic prescription accountability system. I'm going to recommend that we move this measure with amendments. There are technical amendments only. Any discussion? Okay, seeing none, Vice Chair SB 1191 with amendments. Chair votes aye.
Chair votes aye. Vice Chair votes aye. Senator Moriwaki?
Aye.
Senator San Buenaventura?
Aye.
Senator Favela?
Aye.
Chair, your recommendation has been adopted.
Thank you very much. The next measure, SB 1192. This is another electronic prescription accountability system measure, which is in the administrative package. I'm going to note the concerns of Kaiser Permanente. So I recommend we delay the effective date until July 1st, 2021, and hope that the Department of Health can work with Kaiser and the other providers to make sure there's clarity on the requirements. There are also technical amendments. So I recommend we move this as an SD1. So Vice Chair, SB 1192 with amendments. Chair votes aye.
Vice Chair votes aye. Of the other committee members present, any reservations or opposition? Hearing none, aye votes for everybody. Chair, your recommendation's been adopted.
Thank you very much. The next measure, Senate Bill 1155, related to secular marriage. We have some technical amendments, and upon the recommendation of SMA, I'm going to recommend that we amend this bill by redefining civil celebrant to mean a person of secular or non-religious organization who has received the consent of the parties to be married. Any discussion? Okay, seeing none, Vice Chair, SB 1155 with amendments.
Chair votes aye.
Chair votes aye.
Vice Chair votes aye. Of the other members present, any objections or reservations?
No vote for me.
A no vote for Senator Favela, so noted. Anyone else? If not, Chair, your recommendation is adopted. 4 ayes.
Thank you very much. 4 ayes, 1 no. So noted. Thank you very much. SB 1242. This bill establishes a trauma-informed care task force within the Department of Health. A lot of supportive, actually all supportive testimony. I think it's a really important bill and a really important discussion that needs to be broadened out into the community so that there's social acceptance of this term, which will hopefully lead to better utilization and access. I'm going to recommend that we remove the Department of Agriculture from the task force, but add a member of the healthcare community, and also accept the Department of Health amendments, allowing a Department of Health designee if necessary, adding other members to the task force, and adding additional deliverables from the task force. So those are the proposed amendments. Any discussion? Okay, seeing none, Vice Chair, SB 1242 with amendments. Chair votes aye.
Chair votes aye. Vice Chair votes aye. Of the other members on the call, any objections or reservations? Hearing none, measures adopted.
Thank you very much. SB 1186 is the Administration's Controlled Substances Act conformity bill. I'm going to recommend that we pass this with amendments, technical in nature, and keep this bill moving. Any discussion? Okay, if not, Vice Chair, SB 1186, passing with amendments. Chair votes aye.
Vice Chair votes aye. Other members on the call, objections or reservations? If not, 5 ayes, measures adopted.
Thank you very much. SB 1340 related to emergency services personnel. I think that there was a good discussion on this measure. I think it is a very important conversation to have, particularly as it relates to access to care on the neighbor islands. I think those discussions are, especially of sufficiency and efficacy of qualifications, are especially suited for the Consumer Protection Committee. So I'm going to recommend that we defect the date and move this bill out as an SD1. Any discussion? Okay, seeing none, Vice Chair, SB 1340, passing with amendments. Chair votes aye.
Vice Chair votes aye. Anyone else on this call, objections or reservations?
No vote for me.
A no vote for Senator Favela.
Yes.
Okay, got that. 4 ayes, 1 no, measures adopted.
Thank you very much. The next measure, SB 1144. This increases marriage license fees. What I'm going to recommend is that in the committee report, we note the concerns of the Domestic Violence Action Center related to mission creep of the fees. It is a concern, but I'm going to recommend that we move this measure out, blank out the actual fee increase amounts, defect the effective date, and provide other technical amendments. Any discussion? Okay, seeing none, Vice Chair SB 1144, passing with amendments. Chair votes aye.
Vice Chair votes aye. Any of the other members on the call, any objections or reservations? Hearing none, a unanimous 5-0. Measures adopted.
Thank you very much. SB 839. This allows advanced practice registered nurses to practice medical aid in dying in accordance with the scope and practice of their prescribing authority. I'm going to recommend that we pass this measure out with amendments, including the DCCA's requested amendments relating to the terminology of APRNs. There are also technical amendments. Any discussion? Okay, seeing none, Vice Chair SB 839, passing with amendments. Chair votes aye.
Vice Chair votes aye. Of the other members on the call, any objections or reservations?
No vote for me.
Okay, a no vote for Senator Favela. All others voting aye. Measures adopted 4-1.
Thank you very much. The next measure is SB 134 relating to emergency powers. This prohibits the governor or the mayor from suspending requests for public records or vital statistics during a declared state of emergency. You know, I think it's important for us to have this discussion. I do believe that the executive branch of the state and the counties deserve the broad emergency authority that they have to ensure public health and safety. But when we have an extended emergency period like we've had now, so far, where some semblance of life, albeit altered, has returned back to normal, you know, I do think it's appropriate for us to have a discussion about appropriate guardrails of that emergency authority. So I'm going to recommend that we defect the date and keep this bill moving. Any discussion? Okay, if none, Vice Chair SB 134, passing with amendments. Chair votes aye.
Vice Chair votes aye. Of the other members on the call, any objections, reservations on this measure? Hearing none, affirmative all 5. Chair, your recommendation has been adopted.
Thank you very much. The next measure, SB 1138, related to the Office of Healthcare Assurance Special Fund. I'm going to recommend that we blank out the appropriation amounts and allow the Ways and Means Committee to consider the policy aspects related to the ceiling. There are also technical amendments, and we're going to defect the effective date to July 1st, 2050. Any discussion? Okay, seeing none, Vice Chair SB 1138, passing with amendments. Chair votes aye.
Vice Chair votes aye. Of the other members on the call, any objections or reservations to the recommendation of the chair? If not, 5 votes aye, measures adopted. Or I should say
I'm going.
adopted.
Okay, great. Thank you very much. We're going to move into our 1:30 decision-making agenda, so please stand by. I'm going to adjourn the 1 p.m. agenda and open the 1:30 decision-making agenda, Wednesday, February 10th, on 2 bills that were heard last week and were deferred to today. So the first measure, SB 628, is related to the HHSC Oahu transition back to the Department of Health. As mentioned at the hearing, I'm going to recommend that we pass this measure out with technical amendments, a defective effective date to July 1st, 2050. We're also going to accept the Attorney General's proposed amendments and adopt the Department of Health amendments, which were posted in the testimony and are substantial in nature. Any discussion? Okay, seeing none, Vice Chair SB 628, Passing with amendments. Chair votes aye.
Vice Chair votes aye. Of the other members on the call, any objections or reservations? If not, Chair, your recommendation has been adopted.
Thank you very much. The next measure on the agenda is SB 923 relating to pools and the definition of swimming pool. I know that the introducers and the Department of Health are in discussions. There is a House vehicle on this moving, so I'm going to recommend we defer this measure at this time. Any discussion? Okay, seeing none, I'm going to adjourn this agenda and move into our 1:35 p.m. agenda, where we'll be voting on a proposed SD1. So we are adjourned, and I'm going to open the 1:35 p.m. February 10th agenda to consider, to actually vote out the proposed SD1 relating to health, which proposes to amend the implementation date from December 31st, 2023 to December 31st, 2021 for the requirement that qualifying patients obtain medical cannabis or manufactured cannabis products only from a licensed dispensary or by cultivating cannabis as permitted by law. Any discussion? Okay, seeing none. Vice Chair, SB 89 with amendments. Chair votes aye.
Chair votes aye. Senator Baker votes aye. Of the other three members on the call, any objections or reservations? Hearing none, Chair, your recommendation has been adopted.
Thank you very much. Thank you, members, for being on the agenda today. We are adjourned.